Good afternoon, Senator Sear. Welcome back to Beacon Hill Beat.
Always good to be with you, Paula.
Hope you're enjoying your summer. I know that there are a few things out there that are happening that obviously the legislators are aware of and dealing with. And let's dive right into it. We have a COVID situation on Cape Cod in Provincetown. What can you tell us about it? And what mitigation and adaptation are we really looking at with this pandemic?
Sure. So, what Provincetown's going through right now, and what probably is happening elsewhere in the region that we've yet to sort of pick up from surveillance, right, is we're seeing an uptick in COVID-19 cases. However, sort of what that means, and in the case of Provincetown, right, you have a cluster, a significant cluster. What that means, though, for communities like Cape Cod, right, where 81% of eligible people, residents over the age of 12 have been received at least one dose of vaccine. Barnstable County and Nantucket Martha's Vineyard lead the Commonwealth in our vaccination rates. So what that means, what these cases mean, when you have such a high proportion of your community vaccinated, is sort of a little different. And what we're learning to do, and what we're figuring out is we're transitioning into what's called an endemic phase of the virus, where we're learning to live with the virus. And I think for people who are vaccinated, or I should say this, for people who are unvaccinated, this should be a real wake-up call that, COVID-19 is not going away. It's likely going to be something that's with us for quite some time. And hopefully, thanks to vaccines, thanks to good public health, is going to transition to be more like influenza or like a whole host of infectious disease that we sort of encounter in our lives and are able to treat and to address. This should be a real wake-up call if you're unvaccinated, right? That you are at serious risk, that COVID-19 is present in our community, that you are at risk of serious illness, hospitalization, and death. But for those of us who are vaccinated, which is the vast majority of Cape Codders, what this means is a little different. What we see out of the Provincetown cluster is people who are vaccinated, do have symptoms. Those symptoms are mild to moderate. And when I say mild to moderate, I mean that you might be sick in bed, right? But it's manageable, right? It's not something that you need to be hospitalized for, right? Or are significantly ill. The concern really around COVID through the pandemic, through the three waves we've had here on Cape Cod, right, was always about overwhelming the hospital system, right? The hospital, couldn't keep up with the number of people who needed care. So in the case of the Provincetown cluster and Cape wide, right, we're really looking at sort of two important sort of data points here. One is hospitalizations. Hospitalizations remain, quite low. We've got about a handful of people who are in Cape Cod Hospital and Falmouth Hospital. Very much something that's manageable. When I talk to Mike Loff, who's the hospital CEO, they really are viewing this increasingly now as routine, right? So we're looking at those hospitalization numbers. Those hospitalization numbers, get up there, right? Several dozen patients, right? That's something we'd be very concerned about. And the second piece that we're looking at is the test positivity data. We're doing a lot of testing in Provincetown right now. And that test positivity data basically meaning of the people who've been tested, right? What's the percentage of those who are positive? That test positivity data is showing sort of improvement, right? So it was at 15% when we started testing. Now it's down to about 9, 8. It's going to, I think today was 7%. That is indicating there's less and less virus here, and that's a good indicator. But I think that, Cape Codders and Islanders, we've got to sort of transition how we think about COVID-19. And that, yes, this is a serious illness, but for those of us who are vaccinated, vaccination is our best tool to prevent against serious illness, hospitalization, and death. And what I'm really urging people to do, is really to sort of do your own kind of personal risk assessment, right? If you are someone who, has young children who are unvaccinated, or, you have a spouse or a family member who you're in close contact with who's immunocompromised, your behavior, right, may be a little different than, say, someone who is younger and sort of doesn't have sort of those risks. And I think that's how we've got to increasingly think about it, because the vaccines we're seeing, and what we're seeing out of Provincetown in particular, is the vaccines are working. And really, had we not had such a high vaccination rate, and Provincetown is the best vaccinated town in the entire Commonwealth, this would have been a real serious, crisis. And it's not, right? People have gotten sick. We're learning to grapple with the Delta variant, which is more contagious. We're asking people to take sort of common sense precautions, but as we proceed with the rest of the summer and the rest of, as we go into the winter as well, I think I'm just urging people to begin to really follow the science, to follow the public health. And it's really indicating that, at least from a Cape Cod perspective, that COVID-19, is increasingly endemic and is something that a virus that we're learning to live with. And I get that's a hard transition because, so many of us, you and me included, right? So much time really focused on responding to these cases when we didn't have the vaccine. So we're taking it really seriously, but I'm trying to make sure that I am grounding anything and everything I say in the science, in the data, in what public health is telling us. And so that's sort of an update. I expect that we will continue to see COVID cases throughout the summer in the region. When we're just a transient place, we've got a lot of people who are here, who visit. The vast majority of our visitors are vaccinated, but we know that unvaccinated individuals have been coming here. I'm really encouraging people to really do that personal risk assessment and take precautions accordingly. I'm also really encouraging business owners and businesses. If you're a high density business, you should be checking for proof of vaccination, right? Particularly in a bar and a nightclub, something where people are really kind of packed together, right? Those are the kind of tools and strategies I think that we're going to have to rely on as we try to learn to live with the virus, given our high vaccination rate.
Right. It's very telling that Provincetown did institute a advisory at first, and now a mandate has given the town manager, administrator there, the ability to kind of do more mitigation if needed. But it comes back to, what is your risk factors? If you want to wear a mask, and that's just fine, that's great. If you want to stay out of social situations that are density packed, that's okay too. Take your own risk factors and that of your family and your friends, and make sure that you get vaccinated. You started the conversation with this, and having been doing this for the last 18 months, I can't say it enough. Please get vaccinated. There's still many places that you can get vaccinations, and it's really, really one of those important factors to stop the spread, but also to keep you, your families, your communities safe.
Absolutely. Vaccination is sort of our best tool here, and really want to cannot more strongly encourage people to get vaccinated.
Right. So relief from the pandemic, now endemic. There were monies coming from the federal government into the state. Looks like that money should be arriving into our towns shortly. What can you tell us about that, Senator?
So there's sort of several kind of chunks of money coming here through through relief packages passed by the federal government. One is actually direct aids to municipalities across the region, and those dollars are already flowing. But what there also is there's over $5 billion that the Commonwealth of Massachusetts has. The legislature took action to put those funds into a trust, into a specific account. And then we're figuring out, how do we really spend these dollars? This is a real opportunity for us, particularly here in Massachusetts, where, broadly, I think we did, from a revenue perspective in our budget and from our economy, did a lot better, I think, than I think many of us expected when we went into this pandemic. I think we were expecting a pretty difficult situation, and not to say that we haven't had some big challenges. But what the legislature is working on now, we're taking the summer into the early fall to figure this out, is how do you deploy those resources in a way that help us, one, recover, rebuild, restore our economy, particularly for folks who really were harmed by this pandemic. Thinking about how do you support the people as well who work so hard in this pandemic, and then also, this is a real opportunity for us to have some real dollars to address some really big issues. Everyone knows on Cape Cod, we had a housing crisis before the pandemic. That situation's been put on steroids, really. Can we use some of this money to really ramp up housing production in the state? The climate crisis is something that's downright existential for us here. Maybe some of these dollars can be used for really getting some climate resiliency and planning and actually figuring out how we're going to be able to live in our communities in the next several decades as we confront a changing climate, as we confront sea level rise. Can these dollars be used to address the mental health crisis that we have, and really make sure that we in Massachusetts are realizing mental health care that is equitable and that everyone can access. So these are just kind of some of the different the different kind of policy ideas that are kind of kicking around. If constituents have thoughts, ideas, suggestions, please reach out to me. We're sort of actually figuring out how we take this very significant pool of resources and deploy them in a way that's really going to only make Massachusetts more resilient, and that really as we come out of this, that we build something a little bit different here. If you look at the vulnerabilities in our the real vulnerabilities in our communities, which from a public health perspective and a health equity perspective, we knew about before the pandemic. How do we make those right? How do we address that? And I think that's a big part of the conversation. So, from a Beacon Hill agenda perspective, that's on the docket. That's what's on the docket for the rest of the summer into the fall.
Right. And there are so many challenges, as you said, that we could make some inroads in. Wastewater, obviously, that we're thinking.
Wastewater is a huge one. I'm actually hoping too that so there's two more federal pieces of legislation that are moving through Congress. One is a bipartisan infrastructure bill, which actually includes some significant dollars for wastewater, significant dollars for broadband. Those are two very key priorities for Cape Cod. And then there's actually that's sort of the bipartisan package, and then there's the reconciliation package. So even more may be on its way.
Every dollar counts when we want to really make sure that Cape Cod is a livable place for all of our residents, not just the folks that like to come here to visit. Housing, like you said, is one of the challenges that all of our towns are facing, and we want to make sure that it's lifestyle housing, that it's not just affordable housing with a big A. It's a housing for all, right? That we have a place where our seniors can actually downsize, places where our up and coming young professionals can start their careers here on Cape Cod. So we'll look forward to what happens in the legislature. Last thing I want to check with you is that you are on a new task force, the PFAS Taskforce. Again, one of those larger challenges that a lot of our towns now are facing, not just Barnstable, but Chatham as well has seen PFAS in their wells. What can you tell us about the task force and why it was created?
So this is an issue that I teamed up with my colleague, Representative Kate Hogan, who's actually now the Speaker Pro Tem in the House. So she's the third highest ranking member in the House of Representatives. We teamed up, filed legislation, got legislation passed to establish a task force on PFAS. So PFAS, these are emerging contaminants of concern. They're quite ubiquitous, meaning they're present. We're exposed to them a lot, and we're trying to figure out how do we respond to this? There's been a lot of attention, particularly in the Mid-Cape and in the Hyannis water supply around the presence of PFAS and how we mitigate that in public water supply. But PFAS really is present, and these chemicals are present in private wells, in food packaging, in clothing, in a whole host of just materials that we interact with and rely on in our daily lives. And so the task force is doing, we've got a whole kind of cohort of experts. Rep Hogan and I are chairing the task force. We're bringing folks in and we're trying to figure out, how do we assess the extent of PFAS exposure in Massachusetts? How do we develop a bit of a roadmap about how do we address that, right? And so, we actually had a meeting last week. Barnstable Town Manager Mark Ells was among several municipal officials who presented on how Barnstable's been responding. So this is a big issue. We're moving fast. The task force convened at the beginning of the summer. we will have a final report with recommendations by the end of the year. And then we're hoping that we can then move forward with some legislation and hopefully some dollars as well, really to make sure that we're staying ahead of this emerging health concern. But this has been a big issue on the Mid-Cape, big issue in Hyannis, and something that we've prioritized and really pushed to get some action on.
Right. Well, we thank you for your work on that. You know, we know the importance of it here in Barnstable, as well as our area, village of Hyannis. So, you know, the summer is here. It didn't seem like there was an off switch at all in Beacon Hill this year, but are you doing anything fun, Senator?
You know, as a senator for the Cape and Islands district, this is the time of year where my colleagues do not ask me how I am, do not ask what the weather's like, because they know how lucky, you know, Cape Codders and Islanders are. As you can probably tell from my tan, I'm getting some beach days. We've been a little busier than I think we expected to be, especially given the Provincetown cluster. But I actually have a dune shack in 1 week in August. I don't know if folks know about this, but this is sort of the Beacon Hill Trust has a number of dune shacks they manage in the province lands, and so I've got that planned for August. Really looking forward to unplugging. You know, it's a pretty remarkable sort of special thing to do. It's a lottery you apply to, so I have plans for that. I definitely am planning to try to get a little R&R, but you know, this is our busiest season here on Cape Cod, and we always have work to do. So certainly we try not to rest on our laurels, but don't worry, I'm having some fun. I'm getting some R&R, and most importantly, getting in a few swims and beach days.
Excellent. That's fantastic to hear. We thank you for taking the time today out of your busy schedule to talk with us, and we'll look forward to seeing you next month.
You bet. Take care, Paula. Enjoy the rest of the summer.
Thank you.